measles outbreaks here in the United States hitting a new level. The number of new cases is now passing the 1,000 mark. And joining us right now is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. It's always great to see you. Happy Friday. So let's start with the CDC's report, and we'll put the data back up on the screen. 1,001 confirmed cases of the measles in 30 states, not all 50, but 30 states. And that's the second highest number of infections since the U.S. eliminated measles back in 2000. And it's only the month of May. Is the situation out of control? What do you think?
Well, listen, it's not a good situation. Even when you look at the past few weeks, there's been about a 15% increase in West Texas. West Texas has over 700 cases, but this isn't just about Texas. We're now seeing spreads in other places, adjacent states, even in the western part of North Dakota, where the vaccination rates are significantly lower than they need to be. Remember, we need to be in the mid-90s to really get control of this.
And where are we?
In parts of West Texas, we're 80% or below. In North Dakota, the same. It's just not high enough.
And okay, given that situation, so far the only New England states with measles infections are Rhode Island and Vermont. Has Massachusetts been lucky, or is we doing something right here?
Well, New England is doing really well. These have been isolated cases, single cases in both of those states, and they were in international travel. So probably acquired internationally.
Right.
But the bottom line is Massachusetts is going to see a case. The most important thing is we don't see significant spread, and you don't see significant spread when your percentage of immunization is in the 90%.
Right.
And we're in Massachusetts, on average, I think 92, 93%.
So obviously we're getting close to summer, Memorial Day, the unofficial start of summer is right around the corner. So for a lot of families, that means the start of vacations, that's the start up of summer camps. So what's the risk of a measles outbreak affecting those plans?
I'm glad you asked that. In the past, remember, we sometimes forget measles is a respiratory virus. And oftentimes in the past, what has halted the spread is spring and summer. So the question is right now, what's going to happen in the summer in places where there's outbreaks? So I think the key is anytime you're going into a place that's going to have a congregate setting, like summer camp, it's like schools, right? You want to make sure your kids are vaccinated. Remember, in the U.S. right now, when you think about those 1,000 cases, 96% of them were not vaccinated or unknown.
96%.
Right. Only 2% had a single dose of MMR vaccine, and only 2% had both doses. So it is an excellent vaccine. I want people to understand, from my perspective, the benefits far outweigh the risks. But I know there's a lot of mistrust, which makes it difficult.
Dr. T, thanks. Have a great Friday.
You too.
Maria?
All right.